Osteoarthritis is a condition where the cartilage in a joint wears out. Most commonly, I see it in the hip and the knee in my patients. It's an inflammatory process as well as a degenerative process, meaning by the time arthritis is set in, there's not anything we can do to reverse that problem. It's set in and we manage it from here on out. The biggest risk factor is age, as most patients who have osteoarthritis are over 50 or 60. Other specific risk factors are previous infection in the knee, obesity, high impact activity, or injury at a younger age. The way this presents in patients in my clinic is in the knee, they have pain, which is usually a lot worse with weight bearing. A lot of times they'll have trouble with pivoting, going up and down stairs, walking long distances. One of the things I hear the most common is for patients that have grandchildren and they can't get down onto the floor to play with their kids, or if they can get down, they can't get back up. In the hip, it manifests as groin pain most commonly, and difficulty getting in and out of bed, getting in and out of a car, and then again with walking and hard pivots and range of motion in the hip. There's many treatment options for arthritis. I have a lot of patients that come in and they're worried that they are going to have a knee replacement immediately, and that's not the case. The first thing that most people have done, even before they see me, is to modify their activities, and that means simply, if it hurts, don't do it. Secondly, you can use oral medications such as Advil or Aleve, other anti-inflammatories. You can use bracing, you can use a cane or a walker, and then sometimes we'll even go to more invasive treatments such as injections, of which there's various kinds. And then if and when all of those things fail, we look towards surgery. Patients should come see me if they have hip or knee pain that limits their ability to do the things they love. When they have tried all the things that they think they can do to take their pain away and they are no longer having success, come in and see me and we'll get you back to doing the things that you love to do.